Oh, hi there. Just going over this month's CME where we're going to go over the Handtevy system and pediatric treatment and assessment. So let's go ahead and dive into those objectives, shall we? So we're going to introduce the clinical reasoning between System 1 and System 2 parts of the brain. We're going to review the Handtevy system. We're going to go over the treatment of the pediatric patient using this Handtevy system. We're going to explore the importance of pediatric patient safety. All right, so let's go ahead and dive into this slide here. How does recall really work within your brain? There's two systems, System 1, System 2. Let's go ahead and take a look at System 1 here. System 1 has Homer Simpson. Homer Simpson just goes about his day. Doesn't have to worry about anything. He goes to his place of employment, nuclear power plant, right? Goes to his break room, grabs a couple of donuts, his coffee, goes to his console at the nuclear reactor there, puts his feet up. Next thing you know, nuclear reactor is about to explode. While eating his donut, what does he do? He hits the button, saves the day, clocks out, goes to Moe's, and enjoys a fresh, cold Duff beer. System 2. As you see, we got Spock here. Spock is kind of unsure of it, using new parts of his brain, doesn't work real well under stress. He's always questioning, not sure what to do. Probably more worried about if he beams somebody up, or are they going to come back two different people? Who knows? All right, so let's go ahead and dive into this slide right here. If you look at this slide, you'll see a picture of a brain. It shows System 1 and System 2. And it shows exactly where it's labeled within the brain for both systems. A couple of big words I can't pronounce, so I'll let you guys try that on your own. However, I will tell you about System 1. System 1 is our default mode, right? That's where we get up and we just go about our day, whether it's brush your teeth, get dressed, grab some coffee, go to work, and we do our equipment checks. We also perform well under stress because of that muscle memory and training, whether it be that mass casualty incident, that big fire, etc. System 2, however, we're using that new part of our brain, kind of like a little slower processing. We have to kind of take some time on it, take some effort to think about stuff. Logic, we're trying to think if it's logical or not, and it really doesn't work well under stress. I kind of almost want to go with System 2 under the last month and a half with our COVID protocols. Are we wearing PPE or are we not wearing PPE? Are we treating patients inside? Are we treating them outside? Who's going in? Who's doing what? Everything was changing constantly for a couple of weeks, and I know, for one, it was very stressful for all of us. All right, so as you see here, here's a picture of our Handtevy bag, what it looks like and how it's labeled and all the equipment in there, along with our lovely Handtevy book. And now just a short video from one of our own, Lance Michael, who will dive a little bit more into this Handtevy bag.
It's amazing. Watch how Dr. Handtevy unleashes the power of System 1 thinking, making tough drug calculations disappear like magic. For treating kids, the Handtevy system is a must. It goes deep down below the surface to get rid of complicated drug dosages. Have you ever been stressed over weight-based drug calculations? Well, the Handtevy system is tough on drugs, without the damaging side effects of System 2 thinking. If you save one child, then the Handtevy system is paid for itself. Some old-timers say, I still like to tape. Ha! The Handtevy system safely removes the stress from even the most complicated of patients. It's the pediatric system for the patients you love. Add a scoop of Handtevy to every load of pediatric calls. It'll boost the stress-removing power of your treatment. Don't just treat them, Handtevy them.
All right, so the next couple slides here, we're going to go into how this bag will help us transition from using System 2 thinking into System 1 thinking. One, we start with the age, right? What we do is we grab our tape out of the bag, make sure we go from head to toe. We'll go measure them, say this patient's 2 years old, right? From there, we have somebody pick up the book, and we go to page 2-year-old, which is yellow. It's labeled there. You grab that bag that's out of there, that's labeled 2-year-old, has all your predetermined equipment in there, and you're ready to go. From there, we go to the book. As you see here in our book, it shows there on the screen, it shows two different examples. It shows a preemie and a 5-year-old. However, like we said in the previous slide, I'm measured to a 2-year-old. So if I go to my 2-year-old here, has everything listed. A couple of medication pros we need to be aware of. Valium is not listed as Valium, it's actually listed as diazepam. If it actually has two different colors writings where your medications are, it actually shows the route next to it. So for example, diazepam is IV in black writing, then diazepam in rectal is in purple writing. The other thing is volume, right? We don't really need to worry about our doses over here, but we need to worry about volume and how much volume we're going to give this patient and how much fluid, so to speak, with that medication. Finally, down below here, as you see, it has all your joules listed. It has exactly what size ET cuff and all your vital signs that are needed. All right, so take a look at this video Gary Glenn did, diving a little bit more into the Handtevy bag.
Pinellas County EMS utilizes the Handtevy system for all of its pediatric patients. The system is age-based, color-coded medication guide, printed for quick reference. The response bag itself has individual pouches that are age-appropriate and labeled to allow for quick identification. The goal is to bring System 1 thinking, which is fast, automatic, instinctive, to low-frequency, high-acuity calls. When faced with this type of call, the slow or more complex decisions that need to be made cause System 2 thinking to activate. But when properly utilized, the Handtevy system will take the guesswork out of the medication dosages and equipment sizes. Not only does this system work to improve the efficiency of patient care, it also improves the confidence of the clinician. And this confidence translates to a higher quality of patient care. In the following videos, we're going to take a look at System 1 and System 2 thinking. First, let's watch a scenario without the Handtevy system in place.
Yeah, that should work out for me, but I have to check for everyone else. But I'll let you know when I figure out the times. Hey, I'm gonna have to call you right back.
Yes, hurry. Hurry! Alright, paramedics, what's the address of the emergency? What city? What is the emergency? On the floor. The baby's on the floor. No, don't stop it!
SU65, that patient.
I have no pulse. I'm initiating CPR at a rate of 100 to 120.
Copy that. Rest of 65, working the code, first compression. I'm going to be on the BBM. Tony, you're in compressions. Make sure you have adequate depth. Justin, you're on the IO and drugs.
Copy IO.
Tony, we're going to be at a ratio of 15 to 2.
Copy.
He appears to be about 10 kilograms.
Yeah, I'd say that's about right.
With the dose of epi being 0.01 milligrams per kilogram, that's going to give him about 0.1 milligrams. I'm going to go ahead and administer 1 ml.
Fire attack Bravo, Rescue 65, drowning, 2825 Orange Grove Way, Grid 155B, Rescue 65, Fire attack Bravo.
Rescue 65 responding.
Acknowledge Rescue 65 en route to the call on Orange Grove Way, responding for a 1-year-old found in the pool by the babysitter, unresponsive.
Hey, can you get the mom's manual and look up the Handtevy for a 1-year-old?
Alright, so our dose for epinephrine 1 to 10,000 is going to be 0.1 milligrams per kilogram. That'll put our volume at 1 ml. If we have to defibrillate, we'll start at 2 joules and work our way up from there. That'll put our first dose at 20 joules.
Rescue 65, that patient.
I have no pulse. I'm initiating CPR at a rate of 100 to 120.
Copy that. Rescue 65, working the code, first compression. Alright guys, I'm going to be on the BBM. Tony, you're at compressions. Make sure you're getting adequate depth. Justin, you're on the IO and drugs.
Copy.
Tony, we're going to be at a ratio of 15 to 2.
Copy.
I'm going to establish an IO in the left proximal tibia. Are we all in agreement?
I agree.
Yes.
Copy. The dose for Epi 1 to 10,000 is going to be 0.01 milligrams per kilograms. I'm going to go ahead and administer 1 ml. Can I get a MAC check?
So you got Epi 1 to 10,000, urine date, dose 0.1 milligrams, and you're pushing 1 milliliter.
Copy. Epi going in.